Topic assignment, Medical Ophthalmology. Diabetic retinopathy. Dr.VJ, Contents: Diabetes definition, Risk factors, Pathogenesis. Classification: Proliferative, Non-proliferative. Sign and symptoms: DDX and other ocular complication of DM. Treatment and follow-up. Screening for drive. Apply with case study: Diabetes mellitus, group of common metabolic disorders caused by a complex interaction of genetics and environmental factors. Lack of insulin, hypoglycemia. Diagnostic criteria: fasting plasma glucose greater than 126 mg/dl. Type 1 DM, insulin-dependent diabetes, IDDM. Results from pancreatic beta cell destruction, usually leading to absolute or near total insulin deficiency. Type 2 DM, non-insulin dependent diabetes, NIDM. Variable degrees of insulin resistance and impaired insulin secretion, resulting in hyperglycemia and other metabolic derangements due to insufficient insulin action. Diabetes mellitus. Long-standing hyperglycemia leads to multiple organ damage. Macrovascular complications: stroke, heart disease and hypertension. Peripheral vascular disease. Foot problems. Microvascular complications: diabetic eye disease, retinopathy and cataracts. Renal disease. Neuropathy. Diabetic retinopathy. The most severe of ocular complications of diabetes, caused by damage to blood vessels of the retina, leads to retinal damage. Microvascular complication of long-standing diabetes mellitus. 1. Most prevalent cause of legal blindness between the ages of 20 and 65 years. Common in DM type 1 greater than type 2. Risk factors: duration of diabetes, poor metabolic control, pregnancy. Most important: PT diagnosed before age 30 years. 50% doctor after 10 years. 90% doctor after 30 years. Poor metabolic control. Less important, but relevant to development and progression of drive. HbA1c AS, with risk. Pregnancy. AS with rapid progression of drive. Predicating factors: poor pre-pregnancy control of DM, too rapid control during the early stages of pregnancy, preeclampsia and fluid imbalance. Pathogenesis. Microvascular occlusion. Microvascular leakage. Microvascular leakage. Degeneration and loss of pericytes. Capillary wall weakening. Plasma leakage. Microaneurysm. Retinal edema. Hard exudate. Circinate pattern. Intraretinal hemorrhage. Non-proliferative diabetic retinopathy. Right eye, microaneurysm, few flame-shaped and dot blood hemorrhages and hard exudate, with hard exudate in macular area. Neovascularization, moderate non-proliferative diabetic retinopathy. Left eye, microaneurysm, numerous flame-shaped and dot blood hemorrhage, more than 20 dots in forequadrant. Hard exudate, with hard exudate in macular area. Neovascularization, severe non-proliferative diabetic retinopathy. Microvascular occlusion. Endothelial cell damage and proliferation. Capillary basement membrane thickening. Decreased capillary blood flow and perfusion. Increased plasma viscosity. Deformation of RBC. Increased platelet stickiness. Retinal hypoxia. VEGF. AV shunt. ERMA. Neovascularization and fibrovascular proliferation. Rubosis iridis. Proliferative retinopathy. Intraretinal microvascular abnormalities. Vitreous hemorrhage. Tractional retinal detachment. Classification: non-proliferative diabetic retinopathy, NPDR. Proliferative diabetic retinopathy, PDR. Non-proliferative diabetic retinopathy. Mild NPDR. Moderate NPDR. Severe NPDR. Sign NPDR microaneurysm retinal hemorrhage hard exudate. Dot or blot spot. Flame or splinter shape hemorrhage. Hard exudate. Cotton wool spot. Venous beading. Intraretinal microvascular abnormalities, IRMA. Mild NPDR. Microaneurysm. Moderate NPDR, more microaneurysms, scattered hard exudates. Cotton wool spots. Severe NPDR, very severe NPDR, more than one of above 4-to-1 rule. 4 quadrants of severe retinal hemorrhages. 2 quadrants of venous beading. 1 quadrant of ERMA. Very severe NPDR, more than one of above. Microaneurysm. Localized saccular outporchings of capillary wall, red dots. Focal dilatation of capillary wall where pericytes are absent. Fusion of 2 arms of capillary loop. Usually seen in relation to areas of capillary non-perfusion. At the posterior pole ESP temporal to fovea. The earliest signs of drive, microaneurysm. Retinal hemorrhage. Capillary or microaneurysm is weakened rupture intraretinal hemorrhages. Dot and blot hemorrhages. Deep hemorrhage, in a nuclear layer or outer plexiform layer. Usually round or oval. Dot hemorrhages, bright red dots, same size as large microaneurysms. Blot hemorrhages, larger lesions. Flame shape or splinter hemorrhages. More superficial, in nerve fiber layer. Absorbed slowly after several weeks. Indistinguishable from hemorrhage in hypertensive retinopathy. May have coexistence of systemic hypertension, BP must be checked. Hemorrhage. Hard exudate, intraretinal lipid exudates. Yellow deposits of lipid and protein within the retina. Accumulations of lipid leak from surrounding capillaries and microaneurysms. May form a circinate pattern. Hyperlipidemia may correlate with the development of hard exudates. Cotton wool spot, white fluffy lesions in nerve fiber layer. Result from occlusion of retinal precapillary arterioles supplying the nerve fiber layer with concomitant swelling of local nerve fiber axons. Also called soft exudates or nerve fiber layer infarctions. Fluorescein angiography shows no capillary perfusion in the area of the soft exudate. Very common in drive, ESP if PT with height. Venous beading, dilatation and beading of retinal vein. Appearance resembling sausage-shaped dilatation of the retinal veins. Sign of severe NPDR. Intraretinal microvascular abnormalities, IRMA. Abnormal dilated retinal capillaries or may represent intraretinal neovascularization which has not breached the internal limiting membrane of the retina. Indicate severe NPDR, rapidly progress to PDRA. Venous beading. Proliferative diabetic retinopathy. 5% of DMPT. Finding. Neovascularization, NVD, NVE. Vitreous changes. Advanced diabetic eye disease. Final stage of uncontrolled PRD. Glaucoma, neovascularization. Blindness from persistent vitreous hemorrhage, tractional road, opaque membrane formation. 32. 33. Neovascularization of disc. 34. Neovascularization of elsewhere. Fluorescein dye leakages seen in neovascularized area. Neovascularization of the iris. Rubosis iridis. Neovascularization of the iris. Neovascular glaucoma. 39. Vitreous changes. 40. Tractional retinal detachment. Vitreous hemorrhage. NVE. Venous bleeding. Oma. New vessels of the disc, advanced. Signs and symptoms of drive. Blurred or distorted vision or difficulty reading. Floaters. Partial or total loss of vision. A shadow or veil across patient's visual field. Eye pain. 44. 45. 46. 47. Hypertensive retinopathy. Medical therapy prevention treat underlying conditions. Control blood sugar, BUR1C less than 7. Control blood pressure, SBP less than 130 mm of mercury. Control lipid profile -TG, LDL. Correct anemia. Control diabetic nephropathy. Pregnancy makes doctor worsen, laser panretinal photocoagulation, PRP, high-risk PEDR 3/4. Vitreous or preretinal hemorrhage. New vessels. New vessels on optic disc or within 1,500 microns from optic disc rim. Large new vessels. Iris or angle neovascularization. CSME. Photocoagulation focal or grid panretinal, PRP. CSME in both NPDR and PEDR. Panretinal, PRP. PEDR.